Everybody, happy Friday. This is Prof Carol-Ann Benn. If I'm sitting with a big grin on my face because I've just had 10 minutes of complete blonde IT. So I may not know IT, but I know breasts, and just thought I'd share with you to get this recording done. You looking at me via my computer while I'm talking via my phone with the whole IT crowd going, I can't believe she's still on Mac. Okay. Right. So let's start and talk about breasts, which is hopefully something I can give you a little more information about. And the way we're going to start is we're going to take this session and we're going to myth bust. So we'll start by myth busting about breast cancer. So everyone thinks it's a disease of little old people. It's not, okay? It may be that over 70, 1 in 4 people are more likely to get a cancer. But actually, breast cancer, you see it no matter what your sex is, okay, no matter what your race is, no matter what your age is. What we do know is that 65% of people have no risk factors, 25% of family history on mom and dad's side, and only 10 to 12% of single gene mutations. So what do we want to do? Know your norm. Check your breasts. Take your bra up, lift it, have a little shake in front of the mirror. I might be skinny, but if you're skinny, as you get older, you start looking like a pug. You have all these little extra wrinkles that wrinkle their way down your body. But know your norm. Check your skin for moles. Check your breasts. Examine your breasts gently, softly. Don't feel your breasts too hard. Check the nipple to make sure there are no changes on the top. Don't squeeze the nipple because the nipple is a glorified plug. I always say the breast is a modified accessory gland. Really, it's an organ for blondes. That's why I've done breast health. See, I didn't do IT, thank God for the world. Okay. So when you check under your arms for nodes, make sure that you don't lift your arm up above your head because that pulls the structures out. You want to feel gently so that you can feel those glands. And if you feel something that's not right, go and seek medical attention. Don't forget, question your doctors, encourage second opinions. People must talk to you. It's your body, your temple, not the doctor's. And if there is a concern, you can go for something simple like an ultrasound, which is the binocs of looking inside the breast. And if you're older than 35, a mammogram and ultrasound. Mammograms look for calcifications and changes in densities. There is no such thing as an emergency biopsy. Consent implies for anything in medicine that you understand the pros and the cons, the costs around the procedures. It's not an emergency, okay? The entitlement to second opinions and what the alternatives are from a treatment point of view. So let's myth bust a few things around breasts and why bras don't cause cancer. Neither does deodorant. When you choose your bras, though, remember that breasts are asymmetrical, different sizes and shapes, but like that revolting tropical island t-shirt. Some are watermelon, some are mangoes, some are cherries, and they're usually asymmetrical, so that's not abnormal. If you have significant changes in size of the breast, yes, you should see someone because there are a few unusual abnormalities where you have significant differences in breast growth and development. Right. So when you check your bra, you work out the triangle in between your breasts. We all have different gaps and distances. Some people have what we call symastia, their breasts joined together. And then you take the cup and you put your breast into the cup, choose the bigger breast. And because of the different shapes, you're going to use different cups. Remember that straps, the heavier your breasts are, choose a wide strap. And the 32, 34, 36, 38 is the distance around just below your breasts. So we've spoken about checking your breasts, we've spoken about the nipple. Normal to get breast pain. During different phases of your cycle or your life, you'll get breast pain. You can get hormonal pain where your breasts feel full and uncomfortable, like you want to feed a baby. You can get mechanical pain where it shoots down to the nipples when you take your bra off. And you can get something called costochondritis, inflammation in the bones under the breast because the breast sits on a fine netting or Cooper's ligament that goes all the way and around and over the breast. In fact, my husband named his tent Cooper's droop because it had it leaned to the one side. Don't take anything from that, but there we go. So that ligament holds the breast in place, and therefore you can get discomfort on the bones underneath the breast, it's often associated with discomfort between your shoulder blade. But the rule of twos is, if you have pain and discomfort for over 2 weeks, please see a doctor, make sure they take seriously and they check things out. I've seen heart disease and angina and potential heart attacks present with breast pain. I've often seen underlying pneumonias and not uncommonly something called herpes zoster shingles, where people have severe pain and it's the dermatome, the area that extends from the breast round to the back. It usually presents with pain and then a little rash-like, and it's related to that old chickenpox virus. Remember, you can vaccinate against shingles. Please make sure that you vaccinate for whatever you can. Right, so we've done nipples, we've done breast pain. We're going to talk a little bit about, the last type of breast pain. If you get shooting pains through your nipples, slightly common in people who smoke, it's inflammation in the breast ducts associated with duct ectasia. We see a lot of it with the pollution. Your breast can't cough. So you have that discomfort, and often using a topical ointment such as a honey ointment gets absorbed into the ducts and helps. Hard combination of a bug that lives on our skin called staph that goes into the ducts with sweat. And sometimes in young girls and small babies, we see these little inflamed breast buds. Don't let anyone cut or needle. Antibiotics is all you need, because otherwise it can affect the ability for the little breast buds to grow. Breast masses. We don't have eyes on our fingers, so if you feel a lump, you can use a little cheat code. That's 1 centimeter, 2 or 3, but you need to go for a sonar. So most lumps and lots of little lumps in youngsters are fibroadenomas, but again, you go for a sonar and then you do a 3-month follow-up sonar to check, and if it grows, you do a simple needle biopsy. An older woman, and you can see cysts, which are waterfall balloons, and obviously you want to make sure that you don't miss unusual types of breast cancers. The unusual types of breast cancers would be when the breast is red hot and inflamed. Sometimes we see that and we think it's a mastitis. It can be an inflammatory cancer, and easy is when you sonar the glands, they have a specific appearance for the radiologists who sometimes we worry about them missing it. So the other thing that is often missed is pages, a change on the nipple, having glands that are hard where they can't find anything in the breast, then often we need to do a needle biopsy of the gland. Today, how we treat breast cancers. Breast cancers are treated on how they behave. So there are 4 different behavioral types of breast cancers, and it's a bit like saying the difference between TB, malaria, bacteria, and fungus. They are all treated differently, and you want to understand the behavior of the cancer. You want a detailed discussion in a multidisciplinary environment. So you want lots of doctors taking part in decisions making, and you want the information handed back to you by the navigators. In our units, it's all recorded by a clever IT system, and just to make sure that we have good due diligence. So you're not having the blonde surgeon tells you, right, okay, you need to have both your breasts off. That is a misnomer. Cancer doesn't jump from one breast to another. Usually today, we encourage a breast-saving operation wherever possible. Treatment in cancer is de-escalated, and we're really going with the less is more approach. You can go more is more later, but start with the less is more. That's always a good idea. We've de-escalated treatment in oncology, less people needing chemo. We understand the genetics of cancer cells to work out who doesn't need it. We have more targets available, and we're using less radiation. Okay, what we actually have more of and longer duration times is the use of hormonal treatment post-cancer care. And people are so quick to Google all the side effects of treatment. Remember, okay, not treating has side effects too, cancer spreading elsewhere. And often we can manage the side effects if you communicate with your treating team and your navigators. And across the board, whether you're trying to decrease your risk of cancer or you have a cancer, exercise decreases cancer risk significantly, and keeping your BMI under 30, which is not easy, believe me, okay, particularly as you get older. Okay, well, I always say gravity hates women, and so does food, more than it hates men. Hormones don't cause cancer; they are fertilizers. But remember, when you fertilize the roses, the weeds grow too, and they can grow faster. And in a fertilized environment, it's a bit like a jungle, so it's harder to see cancers and other things. Mammograms, okay. People always worry having a mammogram means you have too much radiation exposure. Actually, there's more radiation exposure in a shopping mall. Go for your mammograms, your screening mammograms to check. Can mammograms miss cancers? Yes, sometimes. That's why we do it with an ultrasound. And if something doesn't feel right, even though you've had a normal mammogram, see a clinician. Sometimes the very, very lazy cancers kind of look like sleeping jackals under a bush. They're hard to see on a mammogram. That's why you need to put a clinical together with a radiology and take time, a needle biopsy, and then work out an individualized treatment plan. Other myths: babies biting your breast don't cause cancer. Let me see what else. I've heard recently, can't believe I've got cancer. My mom had it and my daughter had it. I thought it's skipped a generation. No, absolutely not. And you inherit from your mom and your dad's side of the family. Well, on that note, I will send a long 45-minute lecture on the Doctor's Views ABC on breast health that I will record later today, that we'll send a link to, and you can sit and throw popcorn at the screen, and I will cover everything from babies to bugs to boobs to cancer, etc. And you are more than welcome to share it. Thank you. Hi.